question. Do you actually know what your MS medications do? In the next 15 minutes, I'm going to make sure you can answer yes to that question. Today I'm covering the disease-modifying drugs and their prices, relapse drugs, when you get in that situation, and symptom drugs. Plain English, no fluff, let's go. Oh, Ocrevus, the first one, the everywhere in the MS world Ocrevus. And that is, yes, currently the most prescribed MS medication in the United States. Well, since its FDA approval in 2017, it has become the first-line choice for any neurologist treating both relapsing and primary progressive MS. If you were recently diagnosed, well, there's a very high chance that this drug may come up in your appointment's conversation, or if it hasn't, it will soon. So Ocrevus is approved for relapsing forms of MS, including clinically isolated syndrome and relapsing remitting MS. And the great thing about this drug is it's also approved for primary progressive MS. Okay, just know that what I'm about to go over in terms of the price is based off of somebody with no insurance, okay? So take a deep breath there. That number is staggering, I completely understand, but here's the reality. Most patients with commercial insurance end up paying very little out of pocket because of, Genentech, that's the company that produces it, they have a patient assistant program and they have copay cards. And if you have no insurance, the Genentech Access Solutions program may be able to help get you Ocrevus at basically no cost if you meet the income criteria. Always, always, always ask for the manufacturer support line before assuming you can't afford it. Ocrevus is an increased infection risk, and that's because this is a B-cell depleting drug, which means that your immune system is meaningfully suppressed. You need to be up to date on all vaccines before starting, and especially with the live vaccines, they're actually not allowed while you're on Ocrevus. This is, of course, something that's totally worth discussing with your neurologist. The twice-a-year schedule is really convenient, the efficacy data is super strong, and the primary progressive approval makes it, that's super cool and unique. Yes, you have your side effects between the infection risk and the cancer, but those are completely manageable with proper monitoring. This particular drug is one where, the risk-benefit math is ultimately favorable for a lot of people. I liked it when I was on it, and I would absolutely bring it up if your neurologist hasn't already. Okay, next one, Kesimpta. That was approved by the FDA in 2020, so it's of course newer than Ocrevus, but it has grown rapidly in prescriptions because it offers the same class of treatment, the CD20 B-cell depletion, with the ability to self-inject at home. It's become a strong second-line or alternative option to Ocrevus, especially among patients who are needle comfortable but want to avoid frequent infusion center trips. I do have a video posted where I do demonstrate myself giving that. So Kesimpta is approved for relapsing forms of MS, including clinically isolated syndrome, relapsing remitting MS, and active secondary progressive MS. It works through the exact same mechanism as Ocrevus, targeting the CD20 protein on the B cells. So they are in the same drug family, they're just administered differently. If you're weighing convenience and independence and not needle shy, this is a drug to ask about. The retail price for Kesimpta runs approximately $10,000 per month, which lands around $120,000 per year without insurance. With commercial insurance and Novartis's copay assistance program, many eligible patients pay $0 per month. If you're uninsured or underinsured, Novartis offers a patient assistance program, so ask your neurologist's office to connect you with their specialty pharmacy. Okay, so Kesimpta carries the same class of safety concerns as Ocrevus, being that it's in the same world of what it does. And that, of course, includes immune suppression, increased infection risk, and the need for updated vaccines before you start. Again, like Ocrevus, live vaccines are contraindicated, which means you shouldn't get them. And there are also risks of a Hep B reactivation, so you'll be screened for that, obviously, before starting. My take on it is that I love this medication in terms of convenience. The ability to inject at home on a monthly schedule, similar to how, a diabetic would manage your insulin, but obviously not nearly as intense. But it's great because then you don't have to worry about the infusion centers and getting all those tests and exams beforehand. Very simplistic. Next med would be Tysabri. This has been on the market since 2004. And it's had a pretty long track record with MS. I know at the time when it first came out, everybody was super excited about it. So while there are newer options that have taken some of the market share, this does remain one of the most prescribed high efficacy DMTs in the world. Doctors like this medication for patients who haven't really responded well to other treatments or who have a rapidly worsening disease. And neurologists, those docs who specialize in aggressive, particularly MS cases, they tend to look at Tysabri with a lot of confidence on how well it'll help you. Tysabri is approved for relapsing forms of MS, and it works best for patients with active, aggressive relapsing disease, particularly those who've had an inadequate response to the other DMTs. But it works differently than Ocrevus and Kesimpta. It doesn't deplete B cells. Instead, it prevents immune cells from crossing what we call the blood-brain barrier entirely. The way to think of this medication and how it works is essentially like a bouncer that's blocking the entrance to the club, and it'll keep the immune cells from getting into the brain and spinal cord where they then create the damage. Price. Now, each dose of Tysabri runs approximately $8,600 to $9,000 per infusion. And well, since it's administered monthly, you're looking then at anywhere between $104,000 and $108,000 per year at a list price, MSRP, without insurance. But again, with commercial insurance, most patients pay a copay in the hundreds of dollars range, so significantly better. Biogen is the company that makes this medication, and they, of course, also offer a copay assistance program, which can bring costs as low as $0 per infusion for eligible people. They also offer up to a $250 per administration in assistance. I have mentioned this in other videos, but I do want to make sure that you're aware of this. Tysabri particularly is associated with a rare and a potentially fatal brain infection called PML, which stands for progressive multifocal leukoencephalopathy. Yes, I know that is a mouthful. So, before starting this medication, your neurologist will test you for what we call JC virus antibodies. And that's a simple test to determine whether you're positive or negative, if you have it or if you don't. And with that, if you're negative, your risk of PML is actually incredibly low. And we're talking less than 1 in 10,000. But if you're positive, JC virus positive, the risk is higher, and it depends on your antibody index level and how long you've been on the drug. This is not a reason to panic though, and many JC positive patients are on Tysabri successfully under close monitoring. But you must understand this risk, of course, being that there is a risk, and have a thorough conversation with your physician. I certainly, of course, have an appreciation for what Tysabri does for people. It just, of course, wasn't for me, but I know it's worked wonders for others. Yes, there is that PML risk, and it's incredibly frightening, but as long as you're monitoring very closely, then in essence, you should be fine. Next one is Vumerity. Vumerity was approved in 2019 as an improved successor to Tecfidera. And this had been one of the top-selling oral medications since 2013. But Vumerity came on the scene and showed that it had a much better tolerability, especially when it comes to the GI side effects. Many neurologists have been switching patients over because of this. Vumerity has become one of the most prescribed oral DMTs for those with relapsing remitting MS, and especially for newly diagnosed patients who might have that fear of needles, understandably. So Vumerity is best for those with relapsing forms of MS, including that clinically isolated syndrome again, relapsing remitting MS, and active secondary progressive MS. So the list price runs approximately from $9,000 to $9,300 per month without insurance. And that puts the annual costs around $111,000 at full list price. With commercial insurance and Biogen, who's the company that produces this medication, they have a copay card. Many patients can pay as little as $0 to $30 per month. There has also been a generic form of this medication that's been produced, so that can kind of help with the cost, but it'll also create some kind of variation moving forward. All the same, it's a good conversation to have with your neurologist or your pharmacist. And again, just talk to Biogen, reach out. They do have patient assistant programs for uninsured patients. And much like Tecfidera, but not as intense, Vumerity comes, of course, with the side effects of nausea, cramping, diarrhea, and flushing, which is that very warm, hot bath feeling all over the skin. And that's especially right after your doses. The problem with this medication side effect-wise is lymphopenia, and that means a very decreased level of white blood cells. So ultimately, you're at a higher risk of infection because you don't have your soldiers, that's what the white blood cells are, to fight off those germs. Unfortunately, of course, with this, you're going to need to do frequent monitoring of your blood counts. So if they drop too low, you're likely going to have to either pause or very slow down or switch up your treatment based on what your neurologist wants to do. So while I'm not familiar with Vumerity as much, I am very familiar with Tecfidera. And the GI side effects with that medication were legitimately rough for me. I'm talking uncomfortable enough to affect daily life, even my job. So if you're someone who wants an oral option without the commitment of infusions or injections, and who might also have just a lighter kind of case of MS, if you will, rather than a severe disease activity, Vumerity is a very reasonable choice. You just have to make sure that you're very consistent with your blood work and that the low white blood cells and that risk is real and needs to be caught early. Okay, next one would be Copaxone. And that's an oldie. It's a very oldie but a goodie. It's been on the market since 1996 and was for many years one of the most prescribed MS drugs in the world. Its popularity has declined somewhat as higher efficacy DMTs have become available, but it remains widely used, particularly for newly diagnosed patients with a milder disease, for women of childbearing age, and for patients who've been stable on it for years and don't want to switch. It's particularly useful for patients who need an option with the most established long-term safety data, for those who are pregnant or planning pregnancy, and for those patients who prefer to avoid immune suppression. This medication works by modulating, not suppressing the immune system, so that can be very important to many. But again, like the others, it's not super cheap. It's on a little cheaper end, but Copaxone runs approximately $7,300 to $7,900 per month without insurance. So that translates to roughly $88,000 to $96,000 per year. There are generic versions of this medication, and that'll cut the cost to about 15 to 40% less. But it's still expensive, of course, being at $4,000 to $5,000 per month without coverage. With commercial insurance, copay assistance programs can significantly reduce out-of-pocket costs. However, unlike other MS drug manufacturers, Teva, not sure which way you pronounce it, that's who makes Copaxone, they do not offer a direct patient assistance program for uninsured patients. So if you're uninsured, the generic versions through programs like GoodRx or Needy Meds may be a better route. As far as safety, well, the good news is this is where Copaxone shines. It's actually one of the safest medications that we can treat MS with. But it is an injection, so the main side effects are going to be looking out for injection site reactions, redness, swelling, itching, just skin changes, and those are the most common and can worsen with long-term use. My take on it is that, well, Copaxone's super cool for its safety, especially in terms of someone who might be looking to try to have children. But it's a frequent amount of shots throughout the week, so you have to weigh out of what you would prefer in terms of the safety of the medication, or you're okay with getting shots. It's up to you. Steroids are the gold standard for inflammation. They're an anti-inflammatory medication, and that can help you recover from an attack faster. All right, so the first steroid would be the most widely used. It's known as methylprednisolone, otherwise known as Solumedrol. This medication is the absolute standard of care when it comes to an MS flare. So if you're having one, that means your neurological symptoms are meaningfully affecting your function. This is what virtually every neurologist will reach for first. This medication is fantastic, especially when you're in the middle of that flare, for getting you out of it, particularly with, types of symptoms as vision loss, significant weakness, major sensory loss, balance disruption, etc. We're not touching the lesions here. We're just helping those super uncomfortable symptoms with the flare. Most patients pay a standard specialist copay or infusion copay. Without insurance, a multi-day course of IV methylprednisolone or Solumedrol through a hospital or infusion center can run $1,000 to $3,000 plus. However, you might be able to shave a little bit more money off with having a home infusion of steroids rather than in facility. The number one safety issue, or rather side effects in this case, would be insomnia. Steroids will make you feel like you've had 5,000 cups of coffee. So you're normally going to get this medication in the morning. However, it also really messes with your blood sugars and will spike that blood sugar way up. So you're going to have to be careful of that if you have diabetes especially. There's also mood changes, anxiety, agitation, euphoria, all sorts of things that come along with this med. My take on steroids, well, it's a curse and a blessing coming from a nurse standpoint. It is cheap, that's cool, and it's very widely used and does great things when you need it to. However, it does come with a lot of side effects. The next steroid is prednisone, and that comes in oral form. It's used in two main ways: as a taper following IV solumedrol or methylprednisolone, or as a standalone treatment for milder relapses where IV therapy isn't really necessary. In medicine, it is the most widely used corticosteroid in the United States, which means a lot of providers are comfortable prescribing it, sometimes more liberally than is ideal for MS patients. Oral steroids are a legitimate short-term relapse tool. They are not a maintenance therapy for MS, and I want to be direct about this because I have seen patients who are kept on low-dose prednisone for months because it makes them feel better. More energy, less inflammation, what have you, but without anyone addressing what's happening to their bodies or the disease long-term. As for the price, well, generic prednisone is insanely affordable. It's often only about 10 to 20 bucks for a short course at any pharmacy without insurance. So the safety with this, just like methylprednisolone, on the long term, it can create severe bone density loss, elevated blood sugar, leading to potential diabetes development, adrenal suppression, weight gain, kind of puffy, bloaty feeling, muscle weakness, and immune suppression. So if someone or your provider is suggesting that you're on this for a long-term kind of time period, I would question that, just my 2 cents, and really discuss on the whys of that. Again, with my personal experience and as a nurse, I have used prednisone. It has worked great for me with a small flare, had no issues. But is it something that I would do in the long term? No, it is not. Okay, we're gonna start with baclofen, and this is one of the most commonly used drugs in MS symptoms management, and it has been for decades. It's not MS specific. It's used for spasticity for many neurological conditions, but it is a go-to medication for MS-related muscle stiffness and spasms. Baclofen works on the spinal cord to calm the overactive nerve signals driving those spasms. Price. Well, the good news is generic baclofen is very affordable. It's typically about 10 to 30 bucks per month at most pharmacies without insurance. This is up there with steroids, which is great. But there is also an intrathecal baclofen pump option for severe spasticity, which is a very different conversation with very different cost considerations. But usually we go with the oral version, and that is remarkably accessible for most patients. Okay, the biggest thing with this medication is that you cannot abruptly stop it. Abrupt discontinuation of baclofen, or stopping it suddenly, especially at higher doses, can cause serious and dangerous withdrawal syndrome, including severe muscle rigidity, high fever, altered mental status, and in rare cases, seizures or death. This isn't a casual medication, so if you ever need to come off baclofen, it must be a gradual taper under medical supervision. The biggest thing in my take with this medication is that a lot of patients aren't aware of it, and maybe their physician, they don't bring it up, in which they don't know. So they end up ultimately suffering silently with this spasticity or these symptoms they don't need to. So at the end of the day, make sure you are talking about your symptoms with your neurologist and that they're not getting ignored. All right, the next symptom meds are modafinil, also known as Provigil, and amantadine. And these are widely used for MS fatigue and have been for many years. Amantadine tends to be the wider choice because it's older, more affordable, and well tolerated. Modafinil, or Provigil, is used when patients need a stronger wakefulness support. So in terms of who this is best for, well, we know, of course, with our fatigue as MSers, a cup of coffee ain't gonna cut it. So modafinil and amantadine both help the brain maintain wakefulness and alertness against that neurological pull towards exhaustion. Of course, they're not a cure, but for many patients, they provide a meaningful quality of life improvement. Price. Now again, these fall in a little bit more of an affordable category. Amantadine is generic and extremely affordable. It runs around $10 to $40 per month without insurance, making it one of the most cost-accessible options on this list. However, generic modafinil is more expensive, running approximately $30 to $80 per month with discount programs, or potentially much higher without. And as you can guess, Provigil is significantly more expensive without insurance, potentially hundreds per month. So you're probably going to want to ask for the generic version just to help with cost. In terms of safety, well, modafinil carries a small but documented risk of serious skin reactions, including what's called Stevens-Johnson syndrome, and that's a rare but potentially life-threatening skin condition. This risk is very rare, but it's important to know that any new skin rash while taking modafinil should be reported to your doctor immediately. Other common side effects from modafinil can cause, well, headaches, nausea, anxiety, insomnia if it's taken too late in the day, and it should always, of course, be taken in the morning. However, with amantadine, well, it's pretty benign, thank goodness, or safe, if you will. Roughly, you might experience just a mild nausea, and some patients might also see a little mottling on the skin that's called levato reticularis. Long word, I know. But it's all harmless. Okay, next med, dalfampridine or Ampyra. Ampyra is unique on this list because it is the only FDA-approved medication specifically designed to improve the walking speed in people with MS. It's more of a niche drug than the DMTs or steroids, but for patients who have MS-related walking difficulties, it can be generally significant. Unfortunately, the awareness of this medication is kind of low because, well, maybe not all the physicians out there are talking about it. Ampyra is best for MS-related walking impairment, specifically for patients who have had measurable difficulty with walking speed and their leg strength due to their MS. It works as what we call a potassium channel blocker, and this helps those damaged nerve fibers conduct those electrical signals more efficiently. It has shown improvements in walking speed, but the one caveat is that only about 1/3 of patients who try show a meaningful response. So it's worth a trial, but it doesn't work for everyone. Now with price, we're getting back up there again. Ampyra's list price runs approximately $1,700 to $1,900 per month without insurance, so that'll bring you up to about $20,000 to $22,000 per year. With commercial insurance, however, copays vary, but manufacturer assistance is available. Biogen is the company that makes this medication, and they offer a savings program that can reduce costs significantly for eligible commercially insured patients. Unfortunately, there's no generic form of this, so the price is still just going to be high. If cost is a barrier for you, though, discussing this with your neurologist and contacting Biogen's patient support line is worthwhile. The most important safety concern with Ampyra is seizure risk. So dalfampridine lowers the seizure threshold, and it is contraindicated in patients who have a history of seizures. Furthermore, it's really hard on your kidneys. So if you have any sort of severe kidney disease, or moderate for that matter, probably not a good idea. The next medication is Gabapentin, otherwise known as Neurontin. And next to steroids, it's probably one of the most widely used medications across all medical conditions. For example, epilepsy, nerve pain from diabetes, post-herpetic neuralgia, and many other conditions. However, it is considered an off-label treatment for MS. It's not FDA approved specifically for, at least for MS pain, but its use in this population is very common. Ultimately, this medication works on nerve signaling pathways to calm that response. And then price. Well, generic gabapentin is, again, a very affordable medication. It runs around $10 to $30 per month at most pharmacies without insurance. If you have GoodRx or another discount program, it can be as low as $4 to $10. In terms of safety, gabapentin has significant drowsiness and dizziness as its most common side effect, particularly when starting or increasing the dose, which is why neurologists typically start at a low dose and then increase gradually. This is also another medication that you can't just stop cold turkey. You have to slowly taper off, because if you do, you'll have withdrawal symptoms again. So make sure that you speak to your doctor before you start to stop taking it. Okay, let's bring this home. If you're newly diagnosed, you're going to be learning so much really fast. It's going to be like drinking from a fire hose. So I want you to walk away with this with a few things in mind. Number one, your DMT is your long-term protection. It's working even when you can't feel it. Don't skip doses and don't stop without your neurologist's guidance. And understand why you're on what you're on. Number two, steroids shorten relapses. They don't prevent damage. That's your DMT's job. They are not a long-term treatment plan. If someone is keeping you on steroids repeatedly without aggressive DMT management, you need to question that and push back. The third one, symptom management matters. Spasticity, fatigue, walking, pain. There are real tools for all of these. You don't have to white knuckle it. You want to bring these symptoms up by name at your next appointment. Fourth one, you are allowed to ask about cost. You are allowed to ask about patient assistance programs. Every single drug on this list has some form of manufacturer support for eligible patients, and most of them have generic or affordable alternatives. Number five, you are allowed to ask questions. You are allowed to say, I want to understand my options. You are allowed to advocate for yourself in that neurology office. Know that your neurologist is your partner, your teammate, not your authority. If this video helped you, please subscribe. I post regularly on navigating and understanding this disease. And I would love for you to drop a comment below with your biggest question about MS medications or any symptom for that matter that you've experienced. I would be sure, of course, to answer. So take this away. I'm here for you. I fully support you, and I know that you can totally do this. I'll see you in the next video. Take care.